Welcome to Facial Plastics Friday. It's Dr. Brace here, and today we're going to talk about fat grafting. I've covered this topic in the past, so you can go back and look at our reels, but I wanted to go over it again because it's an old technique, but it's up and coming again in facial rejuvenation as people are looking at fat and the benefits that fat brings to a facial rejuvenation procedure. And so to start off, there's different types of fat grafting. It's not all the same. And so there's macro fat grafting, micro fat grafting, and nano fat grafting. Macro fat means big fat molecules. So those fat molecules are harvested with a large liposuction cannula. It has big ports in it, and you get big lumps of fat, and that's basically everything over 2.5 millimeters, 2.4 millimeters. And the problem with that, which we've seen in the past, is when you put large lumps of fat from the belly, the thigh, into the face, it leaves large lumps, and as somebody ages, it can grow with hormonal changes and can look lumpy. And so macro fat really doesn't have much of a place in facial aesthetic surgery, but micro fat and nano fat grafting do. And what micro fat is the same thing. You harvest fat, usually with a micro fat cannula. You pass it through something called an anaerobic transfer, which is a filter which will reduce the size of all those fat particles so they're uniformly less than 2.4 millimeters. And then when you inject that, it adds volume. And so micro fat I use all the time with facial rejuvenation surgeries, facelifts, lower eyelids, to add volume in around the eyes, the cheeks here, and in the temples. You can put it in the chin, you can put it down here, pre-jowl sulcus, you can put it in the mid-face if you're really sunken in there, in the nasolabial folds. It's a permanent filler. It's your own body. It comes from your abdomen or your thigh. It's processed, it's centrifuged in the centrifuge to separate the fat from the oil and the blood, and then when we inject it, we're adding volume. Now fat is funny because it's predictably unpredictable, reliably unreliable, meaning if I put 1 cc of fat here, I'm not going to get the result of 1 cc fat because it's a living tissue. It's an organ system basically, and it's being removed from its blood supply and put into a different space of the body, and it needs to grow a new blood supply. And so in general, you're going to lose a quarter to a half of the fat that you inject, and so you have to add more than you think you're going to need, but you want to be careful not to add too much because you don't want to end up with too much fat. And so there's a bit of an art to it, where you place the fat in terms of the planes, how you place the fat, when you place it during the surgery, how much you place it. But when you get that nailed, when you get really good with fat grafting, you get these beautiful natural results where you don't get the Tyndall effect of filler, so you're not going to get a blue discoloration like you would with filler. Fat is yellow, so it reflects light more naturally like your skin, so you get a glow to your skin. And the great thing about fat is there's stem cells in it. And so if you take your micro fat, you inject to add volume, and you take the rest of the fat that you have left over, because we often have leftover, and you pass it through another series of filters, you can get nano fat. And this is fat that's very small particles, which actually there's no fat in it at all. It's a bit of a misnomer, but you have all of the mesenchymal stem cells and growth factors that live in fat. Fun fact, there are more stem cells in fat than there is in bone marrow. And so when you filter out the microfat into nano fat, you have this stem cell rich solution that you can then inject into the skin. So I love injecting upper lips that are really thin skin and are really wrinkly like a smoker's lip. I love injecting lower eyelids with nano fat at the end of a facelift procedure, in conjunction with a laser cocktail to resurface the skin, with exosomes to help bring some rejuvenative factors to the skin, and then you add the stem cells on top of that. And then the end result is somebody heals faster, they heal with a more natural result, they have volume restoration, their skin glows, it deals with pigment, it deals with fine lines. And so fat grafting really adds a lot when you do it properly to a facial rejuvenation procedure to give a really natural, long-lasting, permanent result that's really just from the patient's own body. And so that's the role that fat grafting plays in my practice. I love using it. I usually talk to people about it if they're thinking about lower eyelid surgery or facelift surgery, because almost everybody has some volume loss as they age and some degree of damage to their skin that the nano fat especially can help with. And so fat grafting, it's fantastic stuff. If you have any questions about that, send them our way, and everybody have a great Facial Plastics Friday.